Hello everyone, I'm Priyanka. I'm back with yet another video on clearance test for renal function. Let us first talk about functions of kidney. Kidney are responsible for the regulation of water, electrolytes, and acid-base balance in the body. Excretion of metabolic waste product. The end products of protein and nucleic acid metabolism are eliminated from the body. These include urea, creatinine, uric acid, sulfate, and phosphate. Retention of substance vital to body. The kidney reabsorb and retain several substances of biochemical importance in the body. For example, glucose, amino acid, etc. Hormonal functions. The kidney also functions as endocrine organs by producing hormones. Erythropoietin, a peptide hormone, stimulates hemoglobin synthesis and formation of erythrocytes. The active form of vitamin D is finally produced in the kidney. It regulates calcium absorption from the gut. Formation of urine. Nephron is the functional unit of kidney. Each kidney is composed of approximately 1 million nephrons. Nephron consists of Bowman capsule with blood capillaries, proximal, convoluted, tubule, loop of Henle, distal, convoluted, tubule, and collecting tubule. The blood supply to kidney is relatively large. About 1200 ml of blood, that is 650 ml plasma, passes through the kidney every minute. About 120 to 125 ml is filtered per minute by the kidney, and this is referred to as glomerular filtration rate. With a normal GFR, that is 120 to 125 ml per minute, the GFR formed in an adult is about 175 to 180 liters per day, out of which only 1.5 liters is excreted as urine. More than 99% of the GFR is reabsorbed by the kidney. Urine formation basically involves two steps: glomerular filtration and tubular reabsorption. Glomerular filtration. This is a passive process that results in the formation of ultrafiltrate of blood. All the unbounded constituent of plasma with a molecular weight greater than 70,000 are passed into the filtrate. The glomerular filtrate is almost similar in composition to plasma. Tubular reabsorption. The renal tubular, that consists ECT, B.Sc, and collecting tubules, retain water and most of the soluble constituent of glomerular filtrate by reabsorption. This may occur either by passive or active process. Next we have renal threshold substances. There are certain substances in the blood whose excretion in urine is dependent on their concentration. Such substances are referred to as renal threshold substances. At the normal concentration in the blood, they are completely reabsorbed by the renal threshold of a substance is defined as its concentration in blood or plasma beyond which it is excreted into urine. The renal threshold for glucose is 180 mg per dl. Ketone bodies 3 mg per dl. Calcium 10 mg per dl. Bicarbonate 30 molar equivalent per liter. Tubular maximum, that is Tm. The maximum capacity of the kidney to absorb a particular substance is called as the tubular maximum, that is Tm. Tubular maximum for glucose is 350 mg per minute. Kidney function tests may be divided into 4 groups. Glomerular filtration test, all the clearance tests that includes inulin, creatinine, urea are included in this group. Tubular functional test that includes urine concentration or dilution test, urine acidification test. Analysis of blood, serum, estimation of blood urea, serum creatinine protein and electrolytes are useful to assess renal function. Next we have urine examination. Routine examination of urine that includes volume, pH, specific gravity, osmolarity and presence of certain abnormal constituents like proteins, blood, ketone bodies, glucose, etc. So here we'll discuss clearance test. Clearance is defined as the volume of the plasma that would be completely clear of a substance per minute. In other words, clearance of a substance refers to the milliliter of the plasma which contains the amount of that substance excreted by kidney per. We can calculate it by using this formula. C is equal to U into V upon P, where U is the concentration of the substance in urine, V is the volume of the urine in ml excreted per minute, where P is the concentration of the substance in plasma. The maximum rate at which the plasma can be cleared of any substance is equal to the GFR. This can be calculated by measuring the clearance of plasma compounds which is freely filtered by the glomeruli and is neither reabsorbed nor secreted in the tubules. Next we have inulin. Inulin is a plant carbohydrate composed of fructose unit and CREDTA satisfy this criteria. Inulin is intravenously administered to measure GFR. Urea clearance test. Urea is the end product of protein metabolism. After filtered by the glomeruli, it is partially reabsorbed by the renal tubule. Urea clearance is less than the GFR and it is influenced by the protein content of the diet. Urea clearance is not as sensitive as creatinine clearance. Urea clearance is defined as the volume of plasma that would be completely clear of urea per minute. We can calculate it by the formula Cm is equal to U into V upon T, where Cm is the maximum urea clearance, U is the urea concentration in urine in mg per dl, V is the urine excreted per minute in ml, and P is the urea concentration in plasma. If the output of the urea is more than 2 ml per minute, this is referred to as maximum urea clearance, and the normal value is around 75 ml per minute. Standard urea clearance. Now the standard urea clearance is when the urea clearance changes when the volume of the urine is less than 2 ml per minute. This is known as the standard urea clearance, indicated by C, and the normal value is around 54 ml per minute. Standard urea clearance is calculated by a modified formula, that is Cs is equal to U into under root V upon P.